Hello, good afternoon, and welcome to our YouTube weekend clinic. My name is Dr. Trudy Ufondu, and I'm going to be your host this afternoon. And I'm sure you'll be wondering why I'm putting on this Mexican hat. Now, this month from the 15th down, it's celebrated as the Hispanic Heritage Month. Now we have so many beautiful, loving Hispanics in our community. So this is a way of identifying with our community who are Hispanics. So please, if you have a Hispanic friend, so Hispanic means it can be a Mexican, it can be all those Latin American, Spanish people, identify with them. Make sure you help them to understand that we value them. But this afternoon, we are going to talk about headaches and pregnancy. This is one of the most important topics for especially pregnant women. So it's possible you're currently pregnant, first trimester, second trimester, third trimester, and suddenly you've noticed you've been having these frequent headaches. And you've been wondering if this headache is actually normal and what might be going on. Is it common with other pregnant women? And you don't really need to, kind of start freaking out because you are not alone. So most pregnant women, about 39% of pregnant women will at least experience headache, either in first trimester, second trimester, or third trimester. Now, it's important you classify your headache. It's important you understand the reason why you might have headaches. There are a couple of things that might lead to headache in pregnancy, which we can correct by changing our lifestyle. So the type of headache that most women will have in pregnancy are not the type of headache you should be freaking out about. So pregnancy is common. Headache in pregnancy is also common. But there are certain characteristics of headaches which might mimic medical conditions. So it's important you note the type of headache you have. But remember, you don't walk alone. So majority of pregnant women, about 39%, will have headache in first trimester, second trimester, or third trimester. Now, there are a couple of adjustments you can make and you can have relief. It's not all headaches that will require you to take painkillers. There are some headaches we can give you painkillers. Then there are some headaches you just need to go and sleep. You avoid stress. Sleep alone can take care of so many headaches. Now, there are some headaches which you need to address immediately because the baby might be in danger and you might be in danger. So that's the reason why we have to pay attention to headaches in pregnancy. If previously, before your pregnancy, you normally experience headaches, then that's a different bottle of fish. But if your headaches in pregnancy is a new development, we need to know why. So let's quickly talk about headaches and pregnancy. So like I mentioned, headache pain during pregnancy is very, very common. So if you're currently pregnant and experiencing headaches, you are not alone. Like I mentioned, in research, current research, we discovered that 39% of women who are currently pregnant will experience headaches either in first trimester, second trimester, or third trimester. Now, though your pregnancy and headaches might kind of have a love-hate relationship, there are different types of headaches. So we have cluster headache, we have tension headache, we have migraine headache, then we have secondary headache. So secondary headache means there are certain things happening in your body which is leading to that headache. But most women that are pregnant will have primary headache. So headaches are broadly divided into primary headache and secondary headache. The headache that is common in pregnancy is primary headache. So primary headache can be cluster headache, tension headache, or migraine headache. Other forms of headache might be a sign that the heart is having problems, the kidney, the liver, and they can manifest in different shapes. Now, headache or pain in your head or neck during first trimester might be entirely from a different origin compared to third and second trimester. So let me explain. Headache pain during your first trimester may happen for different reasons, compared to headache in second trimester. So they might not be the same. Now, in some cases, in as much as headache might be common, it might also be a sign you've developed some medical problem. Now, in pregnancy, the major medical problem we are interested in regarding headache is what? Preeclampsia and eclampsia. Preeclampsia is a hypertension emergency development in pregnancy. In preeclampsia, for some reason, your blood pressure is sustainably high. Then you generalized have body swelling. So suddenly your body is completely swollen and your blood pressure is very high. Now, when we check your urine, we also discover that you have protein in your urine. If you have these three combinations before 20 weeks, you are having preeclampsia. Preeclampsia is a condition we must manage medically to avoid problems to the baby and the mother. If preeclampsia is not managed medically and properly, we can have complications in the mother. We can have complications to the baby. The baby can actually have problems. Some babies can even die. Some women can even die. So hypertensive crisis, hypertensive emergency in pregnancy, which is preeclampsia, must be addressed by an experienced doctor. Most pregnant women having preeclampsia will be admitted in the hospital. Depending on the age of your pregnancy, the best treatment for preeclampsia is what? Delivery of the baby. So please, when you see your ANC doctor next, tell your doctor about any headaches you've had during, before, and after pregnancy. So if in the past you had some types of headache, discuss with your doctor. Don't keep it to yourself. Now, when you're done discussing with your doctor, keep a journal. When you keep a journal of your medical records, of your medical history, like your menstrual cycle, I expect all the women in our group to have their medical records. So keep a record of your headaches. How frequent? How serious? When did they happen? What gives you relief? What makes it worse? Keep it as a journal. You can be in your phone, you can be in your diary. That's okay. Record any other symptoms that might be associated with your headaches. Now, thankfully, like I mentioned, most headaches you will have in pregnancy are not the ones that will give us heart attack. They are not the ones that will worry us a lot. Now, how do we evaluate pregnancy and headaches? When we are evaluating headaches, your healthcare provider will take detailed history. So if you're under me, you know I love asking questions. If you're consulting me, you know I'll ask you about 27 questions. One of the tenets of medical practice is what? History. So I want to know a lot of things about you so I can arrive at what might likely be giving you the problem you're currently having. So we might ask you questions about your medical history, about blood pressure, about depression, or about any medication you're taking. There are some medications you might be taking. It might be over the counter, like multivitamins, and it might be an adverse effect. Headache might be an adverse effect or side effect of particular medications, especially over-the-counter medications. So I want to know if you're taking supplements. I want to know if you're taking multivitamins. Then I also want to know about your lifestyle. Do you drink a lot of coffee? Do you drink a lot of tea? Are you using laxatives? What about your sleep? So I will ask you a lot of questions if you present to the clinic with headache in pregnancy. Now, when we are done doing that, now I'm going to go into detail and look at the pregnancy proper. So I'm going to know the characteristic of that headache. Is it intense? Is it throbbing? Is it, mild? Is it moderate? Does it come in the night? When you eat food, does it make it better? When you're sleeping, do you still have the headaches? Does the headache wake you up from sleep? Does it affect your activities of daily living? I want to ask you extensive questions. So headache can be mild, it can be moderate, it can be severe. Some women can describe their headache as the worst form of headache in your life. If you are having such, there are a couple of immediate things we have to do. We have to check your blood pressure. We have to make sure you're calm. We probably need to admit you. Now, some women can also have vomiting and nausea when they are having this headache. When you are vomiting or you feel like you're vomiting and your head is about splitting, that's a danger sign. We want to get you into the hospital immediately, and we want to begin to have accurate diagnosis. So you see, in pregnancy, that's not the time to start popping paracetamol, ibuprofen, because there are some painkillers. There are some medications you're not supposed to take in pregnancy. So if you are having headaches in pregnancy, the best I can allow you to do once is to take your paracetamol. That's about the safest. If that headache persists, please don't go about repeating the paracetamol. Call your doctor. Now, please do not take ibuprofen. There are some drugs you're not supposed to take in pregnancy. An example of them is what? Ibuprofen. The reason is because they are called NSAIDs, non-steroidal anti-inflammatory drugs. Some of them can complicate your pregnancy. Some of them can lead to bleeding problems. So please avoid ibuprofen and other NSAIDs in pregnancy. Some headache signs might be a sign of emergency. So emergency means if you are having this headache, by 12 a.m., by 1 a.m., you need to go to the emergency room immediately. So I'm going to mention specific headache warning signs, which might be a danger sign that your life is in danger. The life of your baby is in danger. So please listen to me carefully. Number one, if your headache is the worst headache of your life, if I ask you to describe the headache and you tell me this is the worst headache in my life, it feels like my head is about to explode, you need to go to the emergency immediately. Here are the things that might be going on. It's possible that when we check your blood pressure, they are very high. There are some women that are pregnant, they are just ticking time bomb. Some women might have 200 over 100, 200 over 120 blood pressure. That's completely a no-no. Anytime your blood pressure goes up, you're putting your baby in danger. So number one, warning sign in pregnancy, it's severe, worst headache of my life. If you are currently having this type of headache, head to the hospital immediately. Now, if your headache is also leading to blurry vision, you are not seeing clear, everything is doubled up, everything is tripled up, you can't walk clearly, you are feeling dizzy, the whole room is spinning. Blurred vision with headache is a danger sign. You need to begin to find yourself to the hospital immediately. So you call your doctor and you begin to go to the emergency. This is not the time to play games, because we are not just thinking about your own life. The life of your baby is in danger. Both of you can actually die. Now, the third symptom or sign is weakness or numbness. So suddenly you're extremely weak. Your fingers are numb, your legs are numb, you can't find your leg again. It's possible you're having what we call neurological signs of stroke. So you need to find yourself to the hospital immediately. So let me repeat again. Worst headache in your life, blurry vision, weakness or numbness. Now, if you notice that when you're having this headache, you are also running fever and your neck is stiff, so you can't move your neck freely, that's a sign you might also be having some untoward complications. So please, and please, one of the things you have to have in your home as a woman by default, whether you're pregnant or you're believing to be pregnant, is what? Blood pressure measurement kit. Because if you have headache and you measure your blood pressure and it's above 140/90, that's a danger sign. Now, if your blood pressure is up and you're having headache and your leg and your feet and everything is swollen, you have preeclampsia until proven otherwise. So make a point of duty to go and buy a reliable electronic blood pressure measurement kit. Keep it at home. When you're measuring, make sure your hand is at heart level. Once your blood pressure is up and you're having headache, severe headache, blurry vision, weakness, stiff neck, swollen legs, swollen feet, please call your doctor and go to the hospital immediately. The life of your baby and your life is in danger. Now, some pregnant women, remember, you can have sex during pregnancy, right? If we didn't tell you not to have sex, you can have sex any which way you have. Now, if you notice that after sex or after a little activity, little domestic chore, you begin to experience headache. Some women can have sex headaches. That's also a sign that something might be wrong. So we need to get you to the hospital immediately. Now, if you suddenly, previously, you don't normally suffer headache, but you recently notice a new onset migraine-like headache in pregnancy, that's a danger sign. Thankfully, the bottom line, most headaches in your pregnancy are not dangerous. But please present yourself to the hospital so we can know if it's dangerous or not and send you home. Now, when you're doing this, try and help yourself. One of the things you can do to alleviate the headaches you might currently be having is what? To apply some home remedies, some lifestyle modifications. You might want to apply cold compress, put some ice blocks in a stockings, place it in your head, avoid noise, sleep, relax, eat comforting food. When you do this by themselves, that primary headache you have will go. But if after doing all this and your headache continues, then that's the time to go see your doctor. So headache is a common presentation in pregnancy, but you need to be careful so that we can evaluate and make sure that the type of headache you're having, it's not the deadly type of headache. There are so many women that have died from preeclampsia because what happens when we don't manage your preeclampsia, you can graduate to eclampsia. So eclampsia means you're going to actually have convulsions or what you guys call epilepsy, and you can actually die. Now, in Africa, we have so many cultural beliefs. Now, let me tell you something. If you have a pregnant woman, make sure she's properly taken care of. There are certain things we do in Africa that is completely a no-no. Any pregnant woman having convulsions, having epilepsy or fit, it's not from the spirit. She's not Obanje. She is likely having eclampsia. Now, there are a couple of things that can lead to convulsions. If you haven't eaten as a pregnant woman, hypoglycemia, that means your blood sugar dropped, can lead to convulsion. It can be a lot of changes in your body. It might be dehydration. Any of them can lead to convulsion. So stop the stigma, stop the shaming about pregnant women when they have complications. In the same vein, some women after delivery can develop complications. So some women can have maternal blues or maternal depression or maternal psychosis, postpartum depression, after childbirth depression, after childbirth psychosis. It's not evil spirit. It's not people from the villages. Take that lady to the hospital, show that lady care. The problem is most families do not support women. Everything is left for them. A pregnant woman is still running the house, doing domestic chores, driving the kids to school, staying up late night. She's going to break down. So the best you can do for a pregnant woman is to encourage her to do the right things. Okay? So that's my presentation, and I'm going to quickly open the floor so I can take care of your questions. So please go ahead and start asking your questions so I can provide you feedbacks. Okay? Remember, it's Hispanic Heritage Month. That's why you can see Dr. Trudy as an amigo. So remember, this is the logo of our group. We are here to help you. I'm here to help you. So the clinic is currently open. Please ask all your questions in real time. All right, let's go. Please ask your questions. I expect everybody in attendance to ask at least 5 questions, especially if you're pregnant. So you see, I can only do my part, my people. I cannot drag you to do the right things. I know there are so many pregnant women in Facebook. I know there are so many pregnant women in my social media, but some of them might not find this class, possible. They might not find it important, but I'm telling you the truth. This is one of the most important presentations as a pregnant woman. Matter of fact, all our women in our ANC should be in attendance. Pregnancy is not something you joke with. Okay, so let's see what we have. Okay, what are the symptoms of preeclampsia? So I want you to focus on 3 things. Now, make it a point of duty to understand that when I mention certain symptoms, it doesn't necessarily mean everything will happen. So some women might have silent preeclampsia. We can only know if your blood pressure is up by measuring. So some women might have headache and their blood pressure will still be okay. It might just be that you're exhausted, you haven't slept, you need to drink water. Now, in preeclampsia, be on lookout for 3 components. Increase in your blood pressure above 140/90. 140 is the number on top. 90 is the number below. If you check your blood pressure and you have increase in the upper number above 140, an increase in the lower number above 90 mercury, that's the measure of your blood pressure. That's number 1 likely presentation of preeclampsia before 20 weeks. Okay, now the second point which might present in preeclampsia is generalized body swelling, especially your feet and your hands and your face. You notice you have puffy face. That's number 2 signal or sign of preeclampsia. What's the number 3 thing? You have to go to the hospital. We have to collect your urine sample and check for protein in your urine. Ordinarily, you're not supposed to have protein in your urine. If you have 3 of these components, then you will likely have preeclampsia. And we have to admit you. If your baby has gone beyond 37 weeks, we might likely deliver you, because the best treatment of preeclampsia is to deliver the baby. So some women can develop high blood pressure during pregnancy. Once you deliver that baby, their blood pressure will come back to normal. The same thing is applicable to diabetes. Some women can develop diabetes during pregnancy. It's called gestational diabetes. Once that pregnancy is done with, their blood pressure and their blood sugar will come back to normal. But here's the deal. There are some women that might not modify their lifestyle, and the blood pressure and the high blood sugar they develop during pregnancy will now be permanent afterwards. So you do not want to be in that category. You have to make it a conscious effort to revert back to your weight, to revert back to your blood pressure, to revert back to your blood sugar prior to pregnancy. If you are not careful, you will continue to be diabetic, you will continue to be hypertensive, which is not good for you. Okay? All right. Are there tips for relieving mild headaches in pregnancy? Number 1, go easy. You need a lot of support. So number 1 tip is support. When you are pregnant, invite everybody that will give you help. Number 1 person that will help you in pregnancy is your partner. In as much as your partner will not carry that baby, it's only you that will carry that big belly, right? Both of you are pregnant at the same time. Listen to me carefully. When you are pregnant, your partner is pregnant. So the first support system is your husband or your boyfriend or whoever got you pregnant. So that's number 1 tip. Because when you exhaust yourself, when you still carry about doing stuff before you became pregnant as if it's the same, it's going to put a lot of pressure on you. Get some rest. Avoid stress. Drink a lot of water. Sleep. Avoid noise. Avoid staying in a very uncomfortable place for a long time. Avoid bad company. There are some friends that will give you headaches. There are some mothers that will give you headaches. There are some mother-in-laws that will give you headaches. There are some siblings that will give you headaches. There are some friends that will give you headaches. There are some places you will go to, you will argue, you will talk, you will be angry, you won't sleep. Guess what's going to happen? You will have headache. Your blood pressure will go up. So be careful what you do in your pregnancy. These are practical tips. The idea is to make sure that as much as possible, you avoid taking any drugs in pregnancy. But if you've done all this and your headache persists, then you can go to your doctor and we can give you some drugs that are safe. Please don't go taking any drug by yourself in pregnancy. The only one I will allow you to take in pregnancy is paracetamol. 1 time. If you take your paracetamol and that headache is persistent, call your doctor. Don't take it again. Because when you abuse your paracetamol, you're putting a lot of blood in your kidneys and your liver. So don't abuse pain medications. And please don't take ibuprofen in pregnancy. Please avoid any NSAIDs in pregnancy. Okay, let's continue, guys. Okay, I've already mentioned that. Do migraine attacks get worse during 2nd and 3rd trimester? It depends. So pregnancy can change a lot of things in your body. A lot of things in your body can change pregnancy. So some women might notice reduction or increase in frequency of migraine type of headache, either in 1st trimester, 2nd trimester, or 3rd trimester. Now, the key point is to know what might likely aggravate the migraine, or what might likely be a risk factor. There are some women that ordinarily before pregnancy, they normally experience migraine. And there are certain things you can do to help yourself when you're having headache. Let me give you an example. You can't be having headache and you go to a well-lit room like this studio. Very bright, noise everywhere, radio is blasting, TV is everywhere, everybody is making noise. Guess what? Your head will practically explode. So when you're having migraine headache or cluster headache or tension headache in pregnancy, what do? You go to a quiet place. You try and drink a lot of water. You eat food, then you sleep. When you do this, you're going to be good. Okay? Okay, recap some common headaches during pregnancy. I'm going to focus on the common one, which are the primary headaches. Number 1, cluster headache. Number 2, tension headache. Number 3, migraine headaches. So these are the primary headaches. Primary means there is no other medical condition causing this. These are the ones that are happening by themselves. Now, secondary headache means something might be happening to your heart, something might be happening to your kidneys, something might be happening to your liver, and based on that medical condition, you're developing headaches. Okay? So the major types of headaches you will have in pregnancy are the primary headaches. Okay? What lifestyle changes can a pregnant woman, okay, I've already addressed that. Okay? What could be the cause of mild pain around your navel? It can range from nothing to infections, to inflammation, to fibroid, to position, to gas. Now, pain is a non-specific thing. Thankfully, it's mild. So what you need to do is to be mindful. When your pregnant belly is expanding, it's going to put a lot of pressure in the surrounding structures, including your navel. So track that pain you're having. Thankfully, you said it's mild. So keep an eye on it. If it's really worrisome, pop your paracetamol. Then call your doctor if it continues. Okay? All right. I love all the questions coming in. Please keep asking all your questions. Are migraine headaches attack common in early pregnancy? For some women, it can. For some, it might not. So pregnancy can be funny. Some women will notice an increase in attacks of migraine during pregnancy, and some women can notice complete reduction in attack of migraine. So it depends on your own individual body makeup. So some women, it can be more. Some women, it can be less. Okay, let's continue, guys. Is it possible for pregnant women to vomit all through the months? Now, this is also an area that women can react differently. So if you notice, most pregnant women will have increase in vomiting during the first trimester. That's because the level of your so-called beta HCG, which is the pregnancy hormone, is going up. Now, as you are graduating towards second trimester, if you pay attention, you will notice that the vomiting will reduce. Now, some women can have exaggerated vomiting, which we call hyperemesis gravidarum. Some of these women will need to actually admit them in the hospital because when you're vomiting, you're losing fluid. So if you're losing fluid and we are not replacing it, you might be dehydrated. So there are some pregnant women that might have excessive vomiting frequently. We might need to keep them in the hospital and give them some fluid to replace the fluid they are losing. So that particular type of vomiting might be common in some women. So yes, some women might experience vomiting throughout their whole pregnancy, but it's not really common. It's during the first trimester that you likely have more vomiting. But as your pregnancy advances, your vomiting will subside. Okay. All right. Is it possible for pregnant women? Okay, I've already answered that. Can constant headaches be a sign of anemia in pregnancy? Well, to an extent, because what happens in anemia, when your blood volume and when the hemoglobin level is low, you are not having enough blood in your body, so you might not have enough oxygen to distribute to important parts of the body. So yes, headaches can also present with in anemic people, because if you don't have enough blood, your heart will not be pumping enough blood. When your heart is not pumping enough blood, you might not have enough blood in your brain. You might not have enough blood in the head. You might not have enough blood in the important organs in the body. So you can actually present with headaches. So anemia is something we want to avoid in pregnancy. Number one thing we want to take care of in pregnancy in regards to anemia is what? Malaria. Malaria is number one problem in pregnancy. Malaria is number one problem in tropics. Malaria has killed so many people. So when you're pregnant, when you go for your ANC, we give you malaria prophylaxis. So prophylaxis means we have already assumed you have Plasmodium falciparum, which is the malaria parasite in your body. So we'll begin to treat you as if you have malaria by giving you preventive drugs. So all those drugs we give you when you go for your ANC, one of the components is what? Your malaria preventive drugs. Besides your prenatal drugs, we also give you malaria prophylaxis. So prophylaxis means we are preventing you from developing malaria because you live in malaria endemic area. So endemic area means an area that is infested with female Anopheles mosquito. Malaria parasite is traveling there. Like if I go to Nigeria now, I have to treat myself before coming back. Then when I come back, I treat myself because one bite of mosquito can easily give me a deadly form of malaria. But if I'm resident in Nigeria, I can survive better when I have malaria because malaria is commoner in Nigeria. There is no malaria in America here. Okay? So make sure you take all your prenatal multivitamins. Make sure you take all your ANC drugs. One of the drugs they will give you if you're in Africa, especially Nigeria, is what? Malaria prophylaxis. Very important. Guys, we are rounding up, so I'm going to provide more feedbacks. Does acupuncture help in relieving migraine and headaches? Now, in some of the researches, acupuncture is actually part of management of a couple of medical conditions because what they do is to trace a couple of nerves and put special things. So it can happen. Some people can use it, but be careful. Run it by your doctor. Make sure your doctor approves any conventional thing you're doing. So acupuncture might work for some people. Some providers might not approve it. I don't approve it for my clients because I want everything to be conventional practice. But run it by your doctor, okay? All right. Can certain food trigger headaches? Correct. There are certain food items you will need that will trigger headache or make it worse. Now, there are some foods you would also take that will make it mild. Okay? So one of the things you can do is to avoid all high-fat foods and highly processed food. Prepare the foods you eat more fruits and vegetables, drink a lot of water. Now, in some situations, you can take chocolate when you're having a headache. It has a way of making you feel better, okay? All right. Is it okay when trying to conceive to take multivitamin and pregnant care together? Now, let me make it clear, my sister. You are mixing it up. Pregnant care is a type of prenatal multivitamin. Once you have it, you have everything. So you're not supposed to take anything extra. Prenatal multivitamin is the umbrella name of prenatal multivitamin, right? Now, pregnant care is a type of prenatal multivitamin. So if that's what you have, it's enough. You are not supposed to take anything. Multi means all the important vitamins is already there. You don't need to take extra. Okay? Do pregnancy cause frequent farting? Yes. Some women will also notice increase in flatulence. That's called farting because you're producing a lot of gas. So one of the pregnancy maintaining hormone, progesterone, can actually predispose you to having either peptic, increase in production of gas, the relaxation of all the sphincters in the body. So you will notice you fart a lot because you're producing a lot of gas. Okay. So it's not unusual for pregnant women to be farting a lot. Now, in your relationship, there are certain things you have license to do anyhow. Like in this house, I can fart all I can. It can be loud. It can be deadly. It can be anything. This is my home. I have freedom to do it. This is part of your relationship building. So expect as a pregnant woman to have increase in flatulence, increase in farting. It's okay to do that. Your partner can handle that, okay? When you're in a relationship, you are completely open. You are free to do whatever you will do. That's part of building your relationship. Please, can you make baby dead in the womb? What's that? What can make, that's a different bottle of fish. There are so many things that can lead to IUD, intrauterine baby death, okay? So many things. This is why you need to register for your ANC. When you go for your ANC, we'll try as much as possible to make sure we keep an eye on you, keep an eye on your baby so that your baby will not die. Unfortunately, some women might be carrying some dead baby in their body because they don't know the right things. Okay? All right. Can you explain more on 48 hours? What about 48 hours? Are you asking about 48 hours interval of lovemaking? If that's what you're asking, very simple. So the more you make love, the more you're increasing your probability of becoming pregnant, especially if you're above 35. So 48-hour lovemaking as a component of our PPP means when you made love today, Saturday, by tomorrow you rest. You continue Monday. So every other day lovemaking. That's what we preach in this group. So the concept of 48 hours is very simple. Because some women might have irregular cycle and we might not know the exact time that the egg will be released. We don't want to take chances. So we don't promote ovulation sex, fertility window sex. Once you are not bleeding, we encourage you to make love, because the more you make love, the more you're increasing the possibility of the sperm being in the vagina to make sure that they will get to the tube to fertilize the egg. So once you've deposited healthy sperm in the vagina, it can survive up to 5 days and still get a woman pregnant. So it's very important you make love round the corner. Okay, guys, my time is up. Thank you for coming. Keep an eye on our next channel. Now, please, if you haven't subscribed, please make sure you click on the subscription button as we're talking. Every Tuesdays by 7 p.m. my time, which is about 12 a.m. in Nigerian time. That's about the only time I have time. But weekends, I come in early. So I come in by 12 p.m. my Eastern time, which is your 5 p.m. So if you subscribe, you are guaranteed 2 videos weekly, one on Tuesdays and one on Saturdays. Now, please, when you're subscribing, please check the notification bell. The essence of a notification bell is to tell you when I will come live, so you will participate and you can get feedbacks from me. So make sure you subscribe today. Don't leave this particular broadcast without subscribing. It's going to help the channel. It's going to help you, because the reason why I show up every day is very simple. I just want to help. I just want you to get pregnant. I just want you to sustain your pregnancy and have your baby in your hands. This is the reason why I show up. And pretty much every other medical problems you have, the open clinic is an avenue for you to get free medical consult and free medical advice you can now follow up with your own doctor. Okay, so I hope I've helped you today. Please remember, pregnancy is a very delicate situation. Don't walk alone. We don't want you to go the whole 9 months alone. We can work with you. So consider signing up with our ANC group consult so we can walk the walk with you. Remember, your pregnancy is divided into first, second, and third trimester. It's a long time. We don't want to take chances. So I take all my pregnant clients very, very serious. You don't have to cut corners. Invest in saving the baby that God gave you. Do the right things. Thank you for coming. Please, if you have any headache currently in your pregnancy, do the simple little things first. Go and tuck yourself up in a quiet place, eat food, avoid bright lights, sleep. If you do this, your headache will go. But if after doing this and your headache persists, then call your doctor and go get help. Okay? All right. Thank you for coming. I love you guys, and I'll see you guys on You've Made Love for 9 years. Okay. I'll see you guys on Tuesday. Thank you for coming, and God bless you, and bye-bye for now.